For those of you who don't know me, my name is Jeremy Earle. I'm the Senior Vice President for Education Programs, so I oversee our early intervention, preschool, school age, and residential programs. Just want to start off by saying thank you to all of you. It looks like we've got some great attendance on tonight's call, so I'm sure there's lots of people who are curious as to what our reopening plan looks like and what school is going to look like for our students starting in September. Before I get started, while we're kind of waiting for a few additional people to join us, I just want to give you a little background as far as who is on the call with us so far tonight. We've got Kathy Klosner, who's our Chief Program Officer, Lenny Giardino, who's our VP of Education Programs, Patty Sidoran, who oversees all of our therapeutic programs, and then we've got our building principals, including Mike Riho and Amy Kulo-Taylor. We've got Terry Mazzera and Rich Ambruso, who are on the call as well. We've got one of our IT specialists, Lindsay, who is on the call with us. Just as we get going, I want to let everybody know that we are going to use the chat function to be able to ask any questions that you may have. What I am hoping is that during tonight's call, we are able to give you an overview of what our reopening plan looks like and talk a little bit about what school is going to look like starting in September for students in our programs. And then try to address any questions that may come up during the conversation of the call. We do have some of our staff who are monitoring the chat function who will either interrupt in the event that questions come up, or we can save them towards the end and we'll be able to address them at that time. So again, thank you for joining us, and we will kind of jump right in. As far as why we're pulling everybody together and why we put a plan together, the State Education Department released an opening guidance on July 17th that really outlined a number of factors that all schools across the state needed to consider before reopening their programs in September. We received that guidance, I believe it was July 17th, and then needed to have our plan fully formulated and submitted to both the Department of Health and the State Education Department by July 31st. As you read through the 150 plus pages of the state education guidance, it talks about, I think it's 15 different sections that school districts across the state needed to address in order to reopen in September. Our school, being a private school, didn't have to address all of those topics. One of the topics that was part of that school districts needed to address was on intramural sports, or how sports were going to take place. So really the main areas that we needed to focus on as we submitted our plan was on communication and family engagement, health and safety, facilities, nutrition, transportation, social emotional well-being, school schedules, attendance and chronic absenteeism, and technology and connectivity. We are constantly updating this document that has been put together, and I'll talk in a few minutes about where you can find the full document. Our document's a rather lengthy document. We certainly aren't going to have enough time tonight to go through every single page of that document. The document addresses what staff need to do, as well as what families need to do, and how we as a school will be educating the students that attend our programs. So we do have that full document available on our website. So in the development of our plan, we pulled together a number of key staff from across programs. So we had representation from both our preschool program and our school age program. We had a number of staff from different agency departments, including our IT department and the maintenance and security department. And we, over the course of about a week, we put together a draft version of what our plan is today. We then felt it was necessary to get feedback on that document. So we sent our draft off. We sent the draft to various community stakeholders, including partners, school districts, superintendents, to school district CPSE and CSE chairpersons. We had the Oneida County Department of Health who reviewed the plan. Our medical director reviewed the plan. And also members of the Upstate Cerebral Palsy Board of Directors and parents. We took all of the feedback that we got from those different key stakeholder groups, and we integrated the feedback that we received into the final version of this plan. And our plan addresses both our preschool and our school age programs. You know, I just really want to commend the team that was part of developing this. This was you know, a rather onerous task for us. I do have to say, I think our organization was well prepared to put this plan together based on the fact that in reality, we continued to provide programs from March 16th. Our school age program continued to have our residential students in our school buildings from when school closed. And our adult programs continued to be responsible for the care of adults in our programs. So really from March to June, we had a lot of opportunity to fine tune and refine the policies that we needed to address in the state education department. So I think we were in a better position than some of our local school districts who really closed in March and had to figure a lot of this out fresh from when the guidance came out from state ed. So per the state ed guidance, we needed to have our full plan accessible on our website. The link is there. It's upstatecp.org/news/COVID-19. The top of the screen kind of looks like the picture on the left in regards to COVID news and updates. And if you scroll all the way down, almost to the bottom of that page, there's a section titled Education Programs. And there are 4 different links on that page now in that area. The first link is a link to our full reopening plan. We are now on version 2 of that document. We've received new guidance from the State Education Department and Department of Health, and needed to, it was new guidance that went out to all schools, and we needed to add a few additional sections. That's been done and is now on the website. In addition, state ed said that we needed to pull sections of our report out and list them separately for families to be able to access easier. So the next 3 slides are the specific sections from our full plan on contact tracing, on COVID testing, and on remote learning. So those are accessible at all times, and we really believe that this is going to be the location where we continue to keep our plan so that family members can refer to it, and so that family members are able to see if anything has changed as we move forward with additional guidance. So diving into the first section of the plan on communication and family and community engagement. You know, we believe that now that communication with not only our families but also our community partners is more important now than ever. You know, we have always felt a need to communicate with our families, and we are feeling the challenge of doing so when we may not have all of our students in program at the same time. You know, in the past, we very much relied on those low-tech options, including sending notes home in backpacks. And that may not be the most reliable method or the quickest method to get information out. So we have looked over the past several months about ways that we can improve communication using technology. Since the beginning of March, we've been using Google Classroom, and we will continue to use Google Classroom as our learning system where our teachers are able to engage with students. And we will also be sending messages out and posting information through your child's classroom. In addition, the agency has purchased a technology called One Call Now, which is a notification system. This system will allow us to do robocalls or text messages or broadcast emails out to various groups. We're setting those groups up very specific to not only specific sites, but also specific programs. So there will be a group for our entire school age division, our entire preschool program, but there will also be a specific group just for students at the Armory campus and just students for just our residential students. As we feel like we may need to push out different messages to different groups as we move forward throughout the rest of this school year. In addition, we've created a parent and guardian hotline. The number is listed there on the screen, 315-927-3300. We will be able to put a pre-recorded message on that hotline, and it will allow you to leave a voicemail. That voicemail will be directed to me, and then I can either respond back to you with an answer, or I can forward that voicemail on to somebody within our agency who's got the ability to answer the question posed. We're also creating private groups on our social media channels. So there'll be a private Facebook group for our New Discoveries Learning Center and a private Facebook group for our Tradewinds program. And you know, we intend to use those private channels to be able to put out the amazing things that are happening in our classrooms and videos of the great work that our students are doing. But we also will use those private channels to be able to put information out to those specific groups. And we have also created an email that we're giving to our families, which is families@upstatecp.org. And we encourage you to send any questions you may have or any issues you may have with programming to that address. Certainly would encourage you to work through your teacher, through your therapist, or building principals to try to get any issues addressed. But know that this family email address is available, and we certainly are going to be monitoring that. We have a number of staff throughout the agency who will be monitoring that email address and forwarding those questions on to the appropriate staff who will be able to answer those questions. And just again, a reminder as far as questions, there's, I think, a question and answer button at the bottom of the screen. And if you do have any questions throughout this presentation, make sure you post them there and we will get them addressed as quickly as we can. On the screen, you'll see that there's a One Call Now permission form. So in order for us to enroll you in the One Call notification system, we need to be able to have your contact information and the permission to be able to send you either a phone call or a text message or an email. That form will be going out in welcome packets for families. Those welcome packets have been finalized this week with all of the documentation that we need related to the new world that we're living in. So we would encourage you to certainly fill that form out, and when you send in your entire return to school or welcome packet information, make sure that that information is there if you'd like to be enrolled into the One Call Now system. In addition to family, another section on the family and community engagement section of our report of our reopening plan discusses visitors. It really is our goal to try to limit the number of visitors or vendors that are in our program during school hours. So we really are trying to protect the facility between 8:45 or 9 o'clock and 2:30 or 2:45 when our students are in the program. We recognize that not at all times will we be able to schedule a visitor outside of those hours or a vendor outside of those hours. So as such, we will be requiring that any visitor that comes onto our campus, and that would be any family member as well that comes onto the campus, into our school buildings, would go through the single point of entry and that they would go through a screening process. Screening process will include taking your temperature, answering a series of questions related to COVID, and then we will encourage you to either wear a mask or we will provide a mask, and it will be required for all visitors to be masked when in our buildings. We will also be collecting some basic contact information for any visitors that come into the program, including date of birth and address and phone number, in case we need to conduct any sort of or participate in any sort of contact tracing efforts with the Department of Health. State Ed has required that we select and make everybody aware of our COVID-19 coordinator. Denise Williams is a registered nurse who has worked for our agency for a long time. Denise actually retired, and we brought her back out of retirement to be our agency COVID coordinator. Denise has really worked as our COVID coordinator since March, when school started shutting down and the pandemic hit us as hard as it did. Denise has got amazing relationships with the Department of Health in a number of counties, and really is our go-to person with all things COVID related. So if there were to be a situation where somebody were demonstrating symptoms or had a positive case of COVID, Denise will be the first person, whether it be staff or a student, Denise will be the first person that we're working with. And Denise isn't working alone. We have Mary Martell, who is our nurse in our education program. Mary has been involved in this pandemic effort, on the medical side of things since the beginning as well, and is really handling the staff side of our COVID response. We are asking families to partner with us in attempting to keep all of our students and staff safe. If your child was in our program starting this summer, this form may look familiar to you. We are sending home another cover letter and this form that really outlines our expectations for you as family members in regards to your responsibilities. Excuse me. So we are asking that parents or guardians take their child's temperature each day before they send their child to school. That you keep your child home if your child has a temperature greater than 99.9 degrees. That you keep your child home if they have any symptoms of COVID or if they're not feeling well. That you keep your child home if anybody in the house is tested positive for COVID or has symptoms of COVID or has come in contact with somebody who has COVID-19. We would ask that you would pick your child up from school if they develop a temperature or have any symptoms of COVID while they're at school. We're asking families to limit the items that are sent into school to essential items only, and that you place any items that you send into school into a Ziploc bag. We would ask that you only send your child to school on their designated days. And we will we'll get into the program model that we're going to be moving forward with starting in September. It will be the hybrid model, which we're currently operating for the summer program. So if your child is an A child, in the A group, we would ask that they're only sent on Monday, Tuesday, and if they're a part of the B group, only on Thursday, Friday. And we're also asking parents to acknowledge that they are going to have their child's temperature taken when they arrive at school. So we would ask that when you get your welcome packet, that you fill this out and you send it back, either mail it back to us or send it back to your child on the first day of school. If we don't get this back from families, our staff will be reaching out that first week of school and going over and reminding families of these responsibilities on their part. Continuing with health and safety, we will have a designated single point of entry for all of our buildings. That designated single point of entry will have a screening station set up, and anybody who enters our building, whether it be staff, visitors, vendors, will need to be screened as they come through that single point of entry. Our screening for everybody, every staff member that comes in every single day will include having their temperature taken, and they will go through these 4 outlined questions that State Ed and the Department of Health have put forward for us regarding contact or symptoms, contact with somebody who has symptoms or has tested positive. And we really are encouraging our staff to think about, to maybe take their temperature before they come into school, and to think about these questions. And if they are going to answer yes to any of these questions, that they follow the agency call-in process or agency call-in policy. We'd ask you as families to think about these as well. If you take your child's temperature and they have a fever, let's not send them to school. Let's partner together to reduce the risk that could occur to other students or to staff in our program. The reality is, if your student arrives, if your child arrives at our building, we're going to be taking their temperature when they get off the bus. And if they have a fever, we will be sending them home. which leads us into the daily health screenings for students. So all students are going to be screened before entering the building as they get off the bus. And any child who has a fever or a temperature greater than or equal to 100 degrees or showing symptoms related to students will have considered to have failed the health screening. So we are creating isolation rooms in each of our buildings. So if a child does come in with a temperature, they'll be masked and they'll be moved to one of our isolation spaces until you as family members are able to come pick them up. If you transport your child to school, we are asking that you wait until their temperature can be taken before we accept the supervision responsibility for that student. And that's changing a little bit as of September than what we've been doing up to this point. We want to make sure that we're taking that child's temperature before you leave, so that if they do have a fever, we can send them home with you. And if a student is transported on the school bus, per the guidance, we're going to be masking them, moving them into the isolation space, and we'll be giving you a call to let you know that we need to have you come pick them up. Social distancing, I think, is a phrase that was not part of our vocabulary pre-March, and now everybody probably says it more times per day than they care to admit. We are certainly looking at ways that we can increase social distancing in our classrooms and within our buildings. We are staggering the use of the gym and of our outdoor playground spaces. And we're making changes within our classrooms so the desks are all facing the same way, so the students are sitting facing the same way. That said, we recognize that the level of need of our students may make it difficult for social distancing to occur at all times. We recognize that our students may need hand-over-hand assistance, and as such, our staff, in order to provide that assistance, would need to be within 6 feet of a student. We would let families know, we're letting families know that if your child has special medical needs, your child is medically frail, we want you to be aware of the fact that we may not always be maintaining 6 feet of social distance, and that our students may not always maintain 6 feet of social distance. Certainly a skill that we're going to be working on, certainly a skill we're going to be attempting to teach of our kids. But if you have concerns with your child's health, or if they're medically frail, we certainly would encourage you to talk to your medical provider to determine whether an in-person program is appropriate, or whether it may be best to move to an all-virtual or all-remote program. We are requiring that our staff and visitors mask at all times. So anybody who comes into our building will be wearing a mask. And we really feel that we're taking this masking very, very seriously, because of the fact that we know that we're not always going to be able to maintain appropriate social distancing. We are taking the masking a step further, and we are requiring that all of our staff wear surgical masks. The state education department has given us the ability to allow masks, to allow schools to wear various types of homemade masks. And there's been some research recently that has come out, and I'm sure we can all think to our own masks. They're not all of equal weight and effectiveness. So we really feel the best way to keep our students as safe as possible and our staff as safe as possible is to mandate the wearing of the surgical masks. As an agency, we have been buying masks for a long period of time. We have a pretty healthy supply of them right now in our inventory. We recognize that as we go into the fall, obtaining surgical masks may become difficult again, as it was last year, because of limited supply. So we will be monitoring our supply situation, and if we aren't able to continue to get masks, we will certainly allow staff to wear homemade masks, but that will be a decision that would be made only if we're unable to obtain the surgical masks. We also recognize that some of our students may have a hard time with the surgical masks. We may have some students in our program who have hearing impairments, and wearing a mask covering the face would be difficult. A lot of our students receive speech services, and being able to see the mouth is part of what a speech therapist uses or speech pathologist uses to be able to teach how to form appropriate, my speech friends would not be happy with me, but to be able to speak appropriately. We have purchased the masks that are at the lower right-hand corner of this slide that have got a clear barrier in the center of it for those students to be able to see the mouth better. We recognize that some students may have increased behavioral issues as a result of staff wearing masks. So we'll be monitoring which, and approving the wearing of those clear face masks on a case-by-case basis. As far as mask usage for our students, we recognize, again, because of the level of needs of our students, that not every student is going to be able to successfully wear a mask throughout an entire school day. We will not be mandating our students to wear masks while in our building. We certainly are asking that parents send masks to school with your children. We ask that you send that in so that we can work on your child wearing a mask and increasing the tolerance of wearing a mask. It's unfortunate, but for the foreseeable future, in order to go out into the community, we're going to have to wear masks. And we certainly want our teachers and our therapists and our clinicians to be working with your child to increase that skill set, to make them, to increase their ability to wear the mask for a longer period of time so that you are able to go out into public. State Education Department says that in order for a student to wear a mask, they have to be able to demonstrate that they can remove the mask independently and or need to be able to communicate some sort of difficulty with breathing or distress. So we're working with our clinical team and our education team and our nursing team to assess who has got the skill sets to be able to work on mask toleration skills. We've been doing a lot of baseline work and research over the summer and have, I've got to say, been very, very pleasantly surprised by how well our students are doing with this. I think in a lot of cases, they see their teachers wearing the masks, and a lot of the students are wearing them for a much significant period of time than we thought that they would. If we have a student with us who is able to wear a mask for an entire day, that would be fantastic. But we recognize that we want to give them the ability to have a mask break. So if a student is able to wear a mask for a significant period of time, we'll be working with the education and clinical team and nursing team to make decisions about how long a mask break should be and when those should occur. As far as returning to school after a positive case, we recognize with staff and students coming into our program that there is a chance that somebody may test positive for COVID. If somebody tests positive for COVID, we will be directing them to work directly with their local home county's health department. And that would be the case for students. That would be the case for any of our staff as well. In most cases, the county health department is going to make a determination as to whether the individual needs to be in isolation or in quarantine. And if they are placed in isolation or quarantine, we are going to require that they are released from quarantine and have documentation from the health department before they are able to return to the program and return to work. Anybody who tests positive is going to, again, need to provide the documentation releasing them from isolation or quarantine. It will need to have been 10 days since they first demonstrated symptoms of COVID. It will need to be 3 days since those symptoms have improved, including the cough and or shortness of breath. And they need to be fever-free for at least 72 hours without any fever-reducing medication. And again, we have our COVID coordinator who will likely be very involved with working with you, working with the Department of Health, working with our staff in regards to whether or not they can return to school and what needs to be done prior to a return to school. We also recognize that our kids are just going to get sick with something other than COVID. It happens every year. We have ear infections, we have stomach bugs, we have strep throat. So we also have put in place a plan for what needs to happen in order for our students to return to school in the event that they are diagnosed with something other than COVID. Any staff or students that are not diagnosed with COVID can certainly return once they have a written note from a healthcare provider stating that they've been diagnosed with something else, and once there is no fever, for 24 hours without the use of fever-reducing medication. There are some cases where a staff or a child or a family member may have a COVID test for some other reason than symptoms. So this section really talks about a negative COVID test only if you are having a temperature, a shortness of breath, or a cough, if you're demonstrating symptoms for COVID. If your child has to have a COVID test because of a medical procedure, or if one of our staff maybe has a second job at a nursing home and is regularly tested for COVID, this doesn't pertain to them or to those situations. This is really for situations when somebody is having testing done because of symptoms. There are cases where somebody may be having symptoms and may go for a COVID test, and they receive the negative test before the Department of Health releases them from isolation. So the Department of Health may put an individual in isolation without a positive test coming back. So in the event that the Department of Health places somebody in isolation or quarantine, we would need, regardless of whether or not they receive the negative test back, we would also need the release from the Department of Health from isolation or from quarantine. Some information on testing. So we have received a lot of questions whether we're going to do across the board testing for our students and for our staff before they return in September. And we are not. And we've made that decision based on the fact that the Department of Health and the State Education Department have said that we should not be doing across the board testing. Department of Health and SED said that testing really, and the CDC have said that testing really should only be done under certain scenarios, and we are going to be following that guidance from SED and the Department of Health. We also are needing to participate in contact tracing efforts. I had mentioned that on the visitor slide that we're going to be collecting dates of birth and addresses and phone numbers to be able to share with the health department in the event of a positive case. That is true of our students as well and of our staff as well. So we need to be able to know who's in our buildings and who's in our classrooms in the event that somebody tests positive for COVID. So we may need to provide your child's name and date of birth and or phone number or address of everybody who has potentially had contact to a potential exposure. As far as cleaning and disinfecting, we are certainly looking at the number of cleaners and maintenance staff that we have, and we are adding additional cleaners and staff to be able to take over, to be able to be responsive to the increased regulations for cleaning and the increased responsibility that we have for cleaning our facility. That said, we really believe that the responsibility for cleaning and disinfecting lies with each of us. It lies with every single one of our staff members. And we kind of have the feeling that if we say it's somebody else's job, it's leaving the opportunity for our school to be a little less safe. And that is certainly not something that we want. Our staff have been through a very similar training to this, and we have talked about the fact that it is their responsibility to clean those high-touch surfaces on a regular basis. They should be cleaning and multiple times throughout the day. And they have cleaning logs, and our maintenance staff and cleaning staff have cleaning logs that they need to be filling out, showing that cleaning is being done on a regular basis. In regards to nutrition, in our school age program, we for a lot of years have been able to go to a cafeteria and have lunch together as a school or as a portion of our school. And unfortunately, those group scenarios will not be able to happen at this point. and we won't be able to have the family style serving that we have had in some of our programs where students are able to pour their own liquid and serve their own meal and then pass that on to the next student. The state education is asking that students wash their hands with soap and water before they eat, and then again after, and that the meals are pre-packaged or pre-plated by staff so that and then just given to the student. So any meals are going to be offered and provided within the student's classroom, and they will be staying together as that group throughout the day. As far as social emotional well-being, we have a pretty lengthy section in our reopening plan on social emotional well-being. We recognize that this is a very challenging time for our staff, for families, for you, and for our students. And in these uncertain times, we certainly want to be responsive to the needs of you as a family and to the needs of our students in our program. And as such, we have a process, a long-standing process within our programs of treatment team meetings and child study processes that we are able to elevate any sort of concerns that we have to various members within our education team. So we will certainly be using that child study process and treatment team meeting to identify any concerns that any of our team members have with students, and we'll be having conversations with you as family members if concerns arise, and if necessary, we'll be working with the school district to potentially put additional programming in place. We've contracted with a number of consultants as well, and are working on some pretty amazing practices to help work with mass toleration skills, to help teach our students about the time that we're in. And we've got some very well-known consultants from around the world who are helping us with these. I'm proud of our clinical team and our leadership team for bringing these resources in to help our students in this way. I think one of our shortest sections in the plan was in regards to transportation. In regards to transportation, our agency is not responsible for providing transportation to school. For our school age program, the school district is responsible, and for our preschool program, the local county Department of Health is responsible for transportation. That said, we do have a responsibility to the school district and or to the county to make them aware of what our grouping of students looks like, and we're working through that as we speak. And we have a responsibility to let the county health department or school district know if our program model is changing. So that is certainly something that we will be doing and on an ongoing basis. Most of our districts have made us aware, as well as the county health departments, that school bus drivers will not be taking children's temperature as they get on the bus. That's why we're asking families to take on that responsibility. And most of our districts and counties have told us that they are only going to be responsible for transporting the student in the morning on the way to school and in the evening on the way home from school. None of the transportation providers are committing to being able to come pick a sick child up during the day. Again, why we're asking families and giving families the heads up that in the event of a child being sick, we may have to ask you to pick your child up from school. So moving into the school schedule portion of this, we have identified 3 different program variations. The first is an all in-person program model. And you can think of that as what last school year was like from September until March. We have got an all virtual or remote programming model, and you can really think about that as far as what programming was like from March until June. And then we've got our hybrid model, which is the model that we're currently running during our summer program. We have looked at a wide variety of information, talked to our local counties and school districts, and assessed our ability to maintain social distancing in the classroom sizes that we have, and we really believe that the safest mode for us to open schools in September is in the hybrid model. We certainly are not happy about that, but we feel that that is the safest way for us to do so starting in September. Just because we're opening the school year as a hybrid model, it doesn't mean that we are going to stick with a hybrid model for the entire school year. It may work out that way, based on feedback and guidance from the governor and the state education department and the Department of Health. But our ultimate goal would be to move towards an all in-person program where all of our kids are in program 5 days a week. A little bit of information about the hybrid model. And again, if you have a child who is in our program this summer, this is what we're currently doing. So we're going to be breaking our students up into groups, Group A and Group B. Group A will be in person in school on Monday and Tuesday and will receive remote learning on Wednesday, Thursday, Friday. Group B will be receiving that remote instruction on Monday, Tuesday, Wednesday, and will be in school on Thursday, Friday. Just because remote instruction is happening doesn't mean that there won't be opportunities for engagement throughout the day. All of our teachers have been asked to create a set time throughout the day where those students who are receiving remote instruction are able to come into the classroom virtually in order to engage with their peers or to be able to participate in some sort of activity. We will, as I said before, be continuing to use the Google Classroom learning environment to be able to send out materials for students and families. We may be pre-recording portions of the day, and we will again be using that technology. Our therapist will also be performing remote therapeutic instruction as the students, so our telehealth options will be occurring for therapists as well. So what happens on Wednesday? We have no kids technically in school on Wednesday, and all education will happen remotely. Wednesday is going to be a day where we clean the facility. We do a deep clean of the facility in between our two groups. It will be a day for our clinical team and our therapeutic team to be able to provide telehealth sessions or increase remote instruction with families. Student cohorts will be maintained throughout the day, so we won't be, classroom 1 and classroom 3 will not have joint activities together. Classroom 1 will be staying with classroom 1, classroom 3 will be with classroom 3 for the entire day. And it is our responsibility to continue to address students' IEP goals, both on the education side of the house and our clinical program, as well as with our therapists. So we certainly want to partner with you to help achieve those goals. And we have to assess the students' goals as well. And we may need your assistance in that as we move into the school year. Very quickly, the virtual or all remote programming, as I had said before, would be 5 days of instruction remote. And I'll talk in just a couple of slides in regards to how we would decide to move to this model. And then our in-person program, again, would be where we are striving at some point in the school year to move towards with all 5 days of instruction happening in person. So, we may be making decisions to move to a different program model on a site-by-site basis. Based on square footage of classrooms, based on, potential positive case in one of our facilities. So we believe that the move to an all in-person program will take some time. We aren't going to be able to say on Monday that on Tuesday we're starting in-person programming. There are some logistics around busing that would need to happen, around staffing, to be able to ramp up to that all in-person program. But that is, again, our goal to be able to move to that at some point this school year. The more likely scenario, based on some procedures or guidance that have been put in place by the governor, is that we could potentially move from the current hybrid model to an all virtual model. And that is something that we would need to potentially communicate out to you in a very quick basis. Why it is so important for us to enroll all of our students in that One Call Now technology. The governor has said that schools need to close and go to an all remote model if the regional infection rate is greater than 9% using a 7-day average after August 1st. We don't expect you as parents or as family members to know what, to monitor that. That is something we certainly are keeping our eyes on, and we'll be working with our partner school districts in our region to determine whether we need to move to an all remote model. Just a few more slides to get through, and I think I've got a few questions that have come in, so we will address those after we get through these last couple of slides. I just want to make families aware that the State Education Department has got a much greater expectation for engagement in the learning, in the education, in the programming of students than they did from March to June. I think the State Education Department from March to June was of the mindset that this was going to be a short-term situation, and of the mindset that families and students were in crisis, or were trying to figure out how to deal with the new norm of living in a pandemic. And the guidance that has come out from the State Education Department related to attendance and chronic absenteeism is much stronger than it was prior to this summer program or last spring. So we have put some processes in place in regards to reaching out to families if attendance isn't occurring, or engagement in the online learning materials isn't occurring on a regular basis. If our Group A student who is supposed to be there on Monday or Tuesday doesn't show up to school on Monday or Tuesday, and we're not aware as to why. So if somebody is sick, that's a very different situation than not showing up and not answering any calls and not responding to text messages or emails from our staff. So if a student doesn't show up Monday, Tuesday, and hasn't engaged in any of the learning materials the rest of that week, our teachers and our therapists will be bumping that up to our nursing staff and up to our building administrators. The building principals will be attempting to reach out. We may, in some cases, make the decision that we need to send our family support specialists out to have a conversation, to see if it's a technology issue, to see if it is a communication issue, to see if it is somebody in the family is sick and there's just too much going on right now. But again, we want to make you aware that we want to partner with you for the education of your child in these very uncertain and unprecedented times. Very quickly, a huge thank you to our team who helped put this guidance together. This was, again, a cross-divisional and cross-represented, cross-organizational project. Lenny Giardino, Patty Sidoran, Mary Bartel, Jennifer Hummel, Mike Riho, Amy Kulo-Taylor, Tabitha Collins, Lindsay Reagan, Nina Wallace, and Tony Ann Johns, who is with one of our sister programs over in the Calverman Center, the Promise program. All worked together to put this reopening plan together, and really have put a ton of work and effort into getting our students back. A huge thank you to our staff. Our staff are some of the most dedicated, caring individuals I've met, and they wake up every single morning with the goal of making a difference in the lives of the students in our program. And for that, we are eternally grateful, and we recognize we can't do this without their partnership with them, and just thank them for their ongoing efforts on behalf of your children and our family, and you, our families. We want to thank our students. We want to thank our students for being them and for being part of our lives. Having been in this field for over 20 years, the best part of the job was working with the kids, and they brighten our days every day, and we just thank them for being themselves and being part of our lives. We also want to thank you as families. We know that these are really difficult decisions that are being made, and we want to thank you for entrusting us to help educate your children. They are parts of our lives as well, and we take the responsibility of educating them and keeping them safe very, very seriously. A few dates to remember as we move forward into the upcoming school year, which is still really hard for me to wrap my head around, the fact that we are just a couple of weeks away from starting a new school year. September 8th will be our Superintendent's Conference Day. September 9th is going to be the first day of school for our 2020-21 school year. September 9th is a Wednesday, so we won't actually have students in program on that Wednesday, but we will be using that as a day for students and families, for our teachers and therapists to start to reach out to students and families. We want you to recognize that turning on Google Classroom and setting up the classes and the telehealth isn't going to be something that happens overnight. So it may take us a couple of days to get those systems up and running before we start reaching out to engage in the telehealth options or the distance options. First day of school for the school year will be on September 10th for in-person instruction, and our first kids will actually be our Group B students. And on September 14th will be our first day of instruction for our Group A students that following Monday. Certainly want to open it up to questions, and I've got Lindsay and Lenny who I think have been monitoring the chat, so I'll turn it over to them in a second to ask any questions if there are any. I can't see them right now, so we'll see if they've got any questions. Also, just as a refresher, I've got some of those contact information points that I put out during the course of this presentation in regards to where you can find our plan, in regards to that parent hotline that we created and the email address that we created for you to be able to answer questions. So with that, I don't know if Lenny or Lindsay have got anything that they want us to chat about.
We have a few questions. One of them, Mary Bartel, will need your expertise. So the first question I was asked about our medical policy is, what if a child displays allergies like a cough that mimics a COVID type cough? Will he be sent home? Mary, I decided to let you explain what would be our reaction to that.
Sure, no problem. No, not right away. So there are certain symptoms that we look for in COVID-related illness. So just a small cough. First of all, it's a good idea in that welcome packet, there is a health screening in there. If your child has allergies or symptoms such as these, it would be a good idea to note those on that, and that way we could use that as a reference. But no, the teacher would call you. We may ask for some documentation depending on how sick your child seems, but just a cough alone, if they're acting perfectly fine, no temp, no runny nose, no congestion, they wouldn't be sent home immediately, but we would probably ask for a record of that to keep on his file.
Thanks, Mary.
Oh, there's a follow-up question for you, Mary. Same parent, if a teacher or student in the classroom comes down with symptoms after an initial screening, would the whole classroom then have to quarantine?
This is one of those things I think Jeremy touched on earlier. So when we identify somebody with possible COVID symptoms, if they go and be tested, with just symptoms, no, there wouldn't be any quarantining. They would go and get tested or go and get checked out by their physician. If a staff or a student in the classroom came down positive, then we would look at further direction of the Department of Health. Denise and I would work with the Department of Health, and the Department of Health would actually contact the families that were involved and let you know exactly what was required on their end.
Absolutely, and there are, since March, there have been such a wide variety of scenarios related to isolation and quarantine that we don't even begin to try to guess what the Department of Health is going to do. Again, Mary and Denise have got the amazing relationship with the Department of Health. They already know what the questions the Department of Health are going to ask before they ask them, and they're prepared with the information and present that information to the Department of Health official. The Department of Health makes the decision. In some cases, the Department of Health has said it's just the individual who's tested positive. And then in other situations, they have required us to isolate or quarantine an entire room or house or facility. So again, the Department of Health will take control of that. Anything else, Lenny?
We have another parent that asked if both parents work during the day, how would we be able to do virtual learning?
That is a great question. And that's a question I think parents around the state and around the country are trying to figure out. Having a 6-year-old at home, that is certainly something my wife and I are are talking about as well. We recognize that virtual learning may happen outside of normal education time. Our teachers have done an amazing job at adapting to this technology and posting lessons online. They will have opportunities for live engagement, and also will post pre-recorded messages that could happen after hours, that could happen after you get home from work. So it doesn't need to be synchronous. It doesn't need to be happening at the same exact time that the learning is happening for the students who are in program. There will be opportunities for that, but we recognize that that may not be possible for all. Anything else?
I'll double check with Lindsay. Lindsay, did we hit everything?
I think we covered everything. I know we typed some answers in the chat, and I thank everyone for coming out tonight. And you can always work with some of our ed directors, our therapy team, if you guys need anything. Also use kind of the hotline that we have set up and the email address if you have further questions as we progress kind of into our fall session.
And thank you for reminding me of that. So there were some questions I think that were answered that were more child specific, so we are going to take the questions that have been asked from this meeting, from our meeting with our preschool team, and we've done the same presentation with all of our staff. And we're going to put those into a frequently asked question document, and we'll be posting that on our website as well, so that we can get information out to everybody. You know, we thank you for taking the time to be part of this call, and we really are excited about having our students back in person with us. And we know that this is a difficult decision for you as family members. It's a difficult decision for me having a daughter on what we're going to do. So we're hoping that this opportunity to hear what our reopening plan looked like gives you some reassurance that we as an agency are taking this very seriously and are going to do everything we can to keep everybody safe, both our students and staff. So thank you again for your time. If you have any other questions, certainly that family's email address. We recognize that you may have a better relationship with your child's teacher or your child's therapist or your child's building principal. And we certainly encourage you to go those routes as well in order to get answers. If our building leaders and or our teachers aren't comfortable giving an answer, we want them to come to us and ask the experts, Mary, Denise, myself, Lenny, to be able to get you answers to your questions. So we hope you have a fantastic evening. Enjoy the next couple of weeks, and we look forward to seeing you in September. Take care, everybody.